Hi, we are the Weavers, and we are going to be answering your questions.
That's boring.
She's Lauren, I'm Colin. We're answering your questions for Rare Disease Day.
We like talking about Emerson, and Rare Disease Day is a good excuse to do that. So Colin's gonna help me. Yeah.
Yes.
Anything you want to say before?
Any excuse to talk about our daughter is a privilege.
Okay. Emerson has a PIK3CA mutation.
It is an uncommon gene mutation often seen in cancer.
Breast cancer usually. It's a random mutation that just happens around like 3 weeks gestation is what they think. They don't really know what causes it, but here we are.
Yeah, it's a spontaneous mutation, again, as you said, during pregnancy that affects a number of cells in her body, leading to different things like overgrowth for her.
The PIK3CA gene is what plays a part in like cell growth and migration and things like that, and so that's why it generally causes things like overgrowth. The results from her genetic testing just says PIK3CA related overgrowth syndrome, so it's a whole spectrum of conditions. Clinically, she has MCM, which is megalencephaly-capillary malformation, as well as CLOVES, which I don't even remember what that stands for, but that's more of the physical characteristics that she has. MCM is more like the brain involvement. There are a ton of other conditions that are kind of under this PROS umbrella. Another one of those is her hemimegalencephaly, which is her brain condition where the left side of her brain is larger and kind of matured faster than the right side. So that's another condition that's under this umbrella. So with MCM, I think they recently updated this number, but there's under 400 documented cases. I'm not really sure what it is with CLOVES. I'm assuming that there aren't as many kids like Emerson who have symptoms of both. I guess it's pretty common to have overlap between several conditions. And Emerson's particular variant within the PIK3CA, it's like E542K or something like that. I have only ever come across like 3 people with that exact variant. One person in a Facebook group and then 2 other people who were in some random studies. So it's anonymous, so I have no idea who they are. So hers doesn't seem like it's very common. So there's like a huge long list of ways that the PIK3CA gene affects Emerson. If you look at Emerson's chart, she has this huge long list of things. It's not a comprehensive list, and some of it seems a little bit repetitive, but I know they add certain things in because they have to have certain codes for insurance to cover certain things.
Medical history problem list.
Yeah. So hers says monoallelic mutation of PIK3CA gene.
Sure.
Hemimegalencephaly, polymicrogyria, which is she has that on both sides. It's worse on her left hemisphere where she has the hemimegalencephaly. She has like, I think, a strip of it basically on her right side. They also list epilepsy, seizures, infantile spasms, which is all kind of under the same thing, hip dysplasia, developmental delays, vascular abnormality, foot deformity, gait abnormality, fine motor disability, which I feel like you should also say gross motor disability, PIK3CA related segmental overgrowth, which basically that just means only certain parts of her body have overgrowth because her condition is mosaic, which means it doesn't affect every single cell in her body. It's only some of them, which is why she only has overgrowth on the left side of her brain. You'll see it in her left ear, her left foot. She has her birthmarks on her left abdomen. And I guess her right foot is a little bit, it's not like overgrowth necessarily, but it is abnormal. So I think that there's some of those cells there. She has dysphagia, which just means she has issues swallowing. Speech articulation disorder, mixed receptive expressive language disorder, wears glasses. She just had an ophthalmology appointment and we Found out that one eye is nearsighted and one eye is farsighted, which she had that before, and then it seemed like her eyes kind of evened out a little bit, but I guess we're back to that now. Cerebral palsy, and then they also specify the right-sided hemiplegic cerebral palsy. That is because of her hemispherectomy, because when they disconnected the left side of her brain, she lost function in the right side of her body.
To can add a little bit more, she has been able to compensate for that loss, so she's not completely lost function, but she has some contractures in her foot and her arm. Doesn't have great fine motor skills in either arm, hand, but she has better skills in her left side of the body than her right side. If you've ever seen her react to watching Moana or Coco, you'll see that she'll kick her left leg and shake her right or left arm in excitement, which maybe we can add a little clip of that just to remind you.
Cloves, MCM, and then they also include things like constipation, urinary incontinence without sensory awareness, full incontinence of feces, and then leukocytosis and dehydration, but those are just from her last hospital visit. What does this mean for Emerson? She is in therapies multiple times a week. She's not doing that currently. Anyway, she should be in therapy. What they want her to do is 2 OT a week, 1 PT, speech, potentially 4 therapies a week, and they're an hour each. That takes a lot of time. She also has a brain MRI every year. She has renal ultrasounds every 3 months. The reason for that is just because kids with her condition are at higher risk for developing Wilms tumors, which are on the kidneys. The management guidelines for that says to get a renal ultrasound every 3 months. She also has a vascular appointment every 2 months with fasting labs, and that's mostly just for one of the medications that she's on. Otherwise, she would probably just do the vascular appointments every 3 months to go along with her renal ultrasounds. Testing for the PIK3CA gene. We tried to do blood work when she was in the NICU, but everything came back normal. I know some people can get a positive test from cheek swabs or saliva. With Emerson, we ended up having to do a tissue biopsy when she went in for her hip surgery around 5 months old. So they were able to take a sample, and that's when we were able to get the positive results back for the PIK3CA mutation. So when people ask us what her condition is, I kind of have a hard time deciding how much detail I should give. So usually I just say it's a vascular condition or a vascular overgrowth condition, because the physical characteristics are easier for people to notice. She does have lymphatic venous capillary malformations on her side. So she has large port wine stains on her abdomen that she was born with, and they've continued to grow with her. She has a few other lymphatic malformations, which just means like she has these pockets basically of lymphatic fluid. Is that what it's called? They kind of swell and grow and then reduce in size kind of on their own. Sometimes you need treatment for it.
She wears compression garments that we never use to help with her.
Well, she outgrew those. We have an order for new ones that
Yeah.
she's supposed to be wearing.
We've used them 2 or 3 times, maybe more. I'm usually not around when she's wearing them.
They want her to be wearing compression garments on her feet and on her legs when she's sleeping now. We still need to get those.
Oof.
Yeah, that's not going to be fun. But we'll see what happens with her hip surgery.
Yeah, we'll show you some x-rays.
Her left hip is completely out of the socket.
Basically dislocated.
Yeah.
Looking forward to that. She'll be in a cast. Full pelvic cast down to her legs. Her legs out towards the sides, being that for a good 6 weeks, and maybe some bracing after that. I'm not sure.
I have
but,
no idea.
We're in good hands.
Emerson has been hospitalized, let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 times so far. 5 of those were ER visits. She usually gets admitted when she goes into the ER. And most of her hospitalizations have happened because of seizures. That's the main thing that we're always treating. She hasn't had seizures in a year, which has been great, so we can focus on other things, but seizures are always the priority.
Her hospitalization last year, January, she was having seizures anytime she fell asleep for an extended period of time. She would be awoken, we would be awakened by seizures. So she wasn't getting sleep, and the more when she did fall asleep, she'd have seizures, which made her more tired, which would make her fall asleep, and then she'd have more seizures. So it was just
it's really bad.
a horrible cycle of seizures and tiredness and no one getting sleep. Fortunately, that last hospitalization was very good. Found a medication that worked, kept her seizures at bay, and she's been good since then in terms of her seizure activity. But
there's always something else. If it's not the seizures, then we have plenty of other things that we should focus on.
Yeah, like right now, it's diarrhea. Not mine or her diarrhea, Emerson diarrhea. But she's still happy.
Yep, she's still happy.
So questions. Some close friends have asked us questions regarding Emerson, her care, expectations, things like that. So I guess let's see what these questions say.
How do we all primarily communicate?
Through Moana.
I think you'd be surprised how much communication is not verbal. We obviously know Emerson really well, and so she doesn't really have to say anything to communicate most things. We know when she's tired or hungry or she wants to watch her movie. Emerson does understand basic instructions and repetitive kind of things. Like in the morning when I'm helping her get dressed, if I say arm out, she'll pull her arm out of her sleeve, or if I say arm in, she'll push her arm through the sleeve, or if I say head out, she'll put her head down so I can take her shirt over her head. If you say push the button or something like that, she will push her light switch to turn on the light, or push the garage door opener to open the garage.
Sometimes she does so without looking. She'll stick her hand out and feel.
Yeah, she's not really good at visually focusing on the task, so a lot of times she just is feeling around trying to guess where things are, and she's usually pretty good about it. We've also been trying to teach her how to pull the string for the blinds because we have our little routine when she goes in and takes a nap or goes to bed. So she has actually been having fun with that, I think. So anything that we repeat, she gets. Oh, another thing. She's been even more attached to her movies lately. So much so that she's been distracted by the TV when it's not even on. She'll keep looking back behind her to see if her movie's going to turn on. And she wasn't eating or drinking very well. And so one morning I made her finish all of her milk in the morning before I turned on her movie. And now she knows that if she wants to watch her movie, she has to finish all of her drink. And so now she goes through it really fast. So she is good at picking up on things, and she is smart. I just wish we knew exactly how much she understood, and she's just not able to communicate with us. Because I feel like she does understand a lot. There are certain situations where we just wish that she could communicate better with us, because if she's acting like she's in pain or she's uncomfortable, we have no idea what's bothering her. So it's those specific things that we don't know how to communicate. But generally, I think we can tell by her body language and, her disposition.
Yeah, and she's kind of developed teaching her sign language early on, which she
knows one sign.
maybe another one before, but doesn't really use that one. But more was the one we taught her early on, and she uses that for a number of things. Hungry, tired, movie, whatever it might be. That we can
excited.
We can tell what she wants, and just based on her reaction.
I feel like we can just tell. It was somebody at church who asked Emerson a question, and I said, "Oh, she doesn't talk." And they said, "Oh, but that doesn't mean that she can't communicate. She knows how to communicate the things that she wants." I was like, "Well, that's true."
That's true.
How often does she see Grandma and Grandpa? Almost every day.
Nearly every day. Yeah, they live 5 minutes down the road.
Yeah, so.
For better and for worse. Just kidding. It's been very helpful. My parents have been very helpful with Emerson, and especially with having Rhett.
In COVID, because with all the COVID protocols, I can't take Rhett to Emerson's appointments. I can't take Emerson to Rhett's appointments, and so if we have anything going on, then they have to be watching one of the kids.
Shout out to them for their selflessness and willing to drop whatever.
Everything.
They literally dropped everything that they knew, that they grew up with in San Diego, moved here.
Yeah.
To be closer and to be of help. So
Yep.
thank you.
How is she adjusting to being a big sister? She is pretty much totally indifferent. She does not care about Rhett.
Who's that? Is that your little brother? Oh, yeah, nothing on the TV. He'll be right there in front of her, and she does not acknowledge him.
She could not be bothered. I mean,
No.
we've brought him into her room when she's going to sleep, and she just totally ignores him. Even if he's crying, she doesn't care. She'll go to sleep.
Sometimes she'll like reach out, to her peripheral and just
Push him away.
push him away, or feel his head, feel his face.
Yeah, she doesn't care. I think,
But he likes her.
he does. He loves her. He will stare at her all day. He's so interested in what she's doing. So hopefully, when he can start interacting with her more, then she'll be more interested in him. I don't know. We'll see. Are there any supplements that we give her that aren't medication but we found are helpful? All of Emerson's medications are pretty much for seizures. Anything that's a supplement is pretty much all for constipation. She has motility issues since she's not active. She doesn't walk. She has a hard time going to the bathroom. So most of the time when we're not dealing with diarrhea like we are right now, we're dealing with constipation.
One or the other.
Yeah.
Lauren's gonna go grab a paste. Yeah, it is. I pushed record. I know how to work this thing. I haven't watched you do it. But it's pretty good, if I say so myself. So shout out to, what is it called? Fruit Ease. I've actually recommended it to one of our patients because, I have to deal with a lot of constipation at work.
You deal with a lot of constipation? So Emerson gets this Fruities
It's pretty good.
for,
It's good.
yeah, for constipation. We just started doing that. We're not really sure how much it's doing, but she seemed to do pretty well with the prune juice when she was younger. So this has prunes, raisins, dates, and prune juice. So I don't know. We'll just stick anything in her pretty much. She also gets a probiotic that has fiber in it. She gets that in her drink every day. Does she get anything else for constipation?
Water.
Lots of water.
Oatmeal every morning.
She does have oatmeal every morning. If she's really struggling, which has happened enough that we have several boxes of these, we give her a rectal suppository, and that usually
90% of the time.
takes care of it pretty quickly.
And it's kind of sad after that because maybe a little too much information.
Never.
I don't know how she can get that size poop out.
She has had a lot of trouble with her bowel movements. We'll just say that. Some of the few times that she's ever cried in her life has been when she's trying to go to the bathroom. The other thing we also give her is we give her gummy melatonin. If it'll focus on, yeah, there we go. We give her gummy melatonin. Was it when we started this new seizure med?
Yeah, when we started the Onfi or the Clobazam.
Yeah.
Clobazam.
When we started that, she started having issues with sleeping, which they said would take about a few months to even out, which it did eventually. Her sleep has gotten better. She still needs melatonin to fall asleep. So she just gets like a little 1 milligram gummy.
That we tear up.
That we tear up. She can't chew that.
She doesn't chew.
Yeah, she doesn't chew anything. That's kind of like with the dysphagia thing too. So we tear up her little gummy. She gets the 1 milligram, and that's how she falls asleep, because there have been a few times where we haven't given it to her and she can't fall asleep. There have been maybe like a handful of times where she has just been so tired that she hasn't needed it, but the majority of the time she can't fall asleep without her little dose of melatonin.
We have gotten a lot of questions over the years about trying CBD oil.
Oh, I was going to talk about that.
When we were kind of
Desperate
back before she was a year old. She was losing control of seizures and having seizures very frequently, and ultimately what led us to have her as a hemispherectomy. But yes, we did try CBD oil.
And not just one. We tried 3 different brands. We tried 2 before her hemispherectomy. Actually, one was CBD, one was THCA, which is the raw form of THC, which I've also heard is really good for seizures, but Not only did it not work before her hemispherectomy, but within a day or two of starting it, her seizures actually got worse. So we stopped that. We tried it again when her seizures started to get bad after her hemispherectomy, so like a year after. We tried it for like 2 months and saw no effect at all, for better or worse. It just didn't work for Emerson.
So that's okay. We found something else.
Will she eventually have to have surgery on her foot for shoes?
Good question.
Emerson's overgrowth on her foot is a lot of soft tissue. A lot of times what will happen is if a child is walking and needs to fit into shoes, then they'll have what's called a debulking surgery where they remove a lot of that soft tissue. Sometimes they'll remove like a toe or two depending on the shape of the foot. In Emerson's case, since she's not walking, we haven't discussed that. I think since she was first born, we like briefly mentioned it. Hasn't been brought up again because she's not walking. If she was, then they would probably remove a lot of soft tissue and then probably take off her big toe, because it's actually the smallest toe on that foot and it kind of goes off to the side. It's kind of like a hand almost. So they would probably just remove that so that she could fit her foot in a shoe.
I mentioned before, she does have kind of a contracture of her left foot where her foot basically, her right foot basically cocks in like this.
It's kind of like club foot.
Club foot.
Yeah.
And it's just kind of become deformed. Nah, not deformed, but
it's just really tight and it's hard to stretch out. So she's actually going to see a club foot specialist next week to see if that's maybe something that we can operate on while she's having her hip surgery as well, just so we can knock it all out in one procedure.
Does she expect to live a full life, or are doctors hesitant to tell you that information?
I guess it depends on what you mean by full life. Like, do you mean length of life or quality of life?
Well, let's just...
we could answer both.
Both. So we found out about Emerson's condition from ultrasound when Lauren was about 21 weeks pregnant, followed by a fetal MRI. They gave us a little bit more information about the likelihood and possibility of her future and the likelihood of seizures and overall, what do you call it? Prognosis, just an unknown / poor prognosis. You know, didn't really get a whole lot of information.
I mean, that's what every website says. If you look up the condition, it just says prognosis is poor, and that is all it says. I think as far as quality of life, we will do everything that we can to make sure that she has the best life and she has all of her needs met. However, she is going to have limitations. Obviously, she has developmental delays, so she has cognitive disabilities and obviously physical disabilities as well. As far as length of life, the doctors are not going to tell us that either because it's such a spectrum. I know people with MCM who are in their late 20s and 30s, maybe even older, but those people also don't have some of the other conditions that Emerson has, where they were having frequent seizures and they're not as delayed. I feel like anything could happen at any time. Any sort of complication could just like crop up and knock the wind out of us, I guess.
Yeah, any complication related to seizure activity.
Or even vascular. Any sort of vascular complication could happen. You never know. I think seizures have just been our primary concern, and so that's what we've always kind of assumed would, I don't know, I feel like bad saying, like, we feel like seizures will be the thing that takes her from us. I don't know. It could be anything, really. I mean, she could get a tumor. She could have some sort of vascular complication. We don't know. And so the doctors are never going to address that, because you just never know what can happen. I feel like the only time that they will ever talk about that is if we were to enter a palliative state where we're prepping for end of life. On a lighter note, has she started talking or signing? No.
More.
She signs more.
More like this.
Yeah. She doesn't have like the fine motor skills with her fingers, and so it's just kind of like a general bringing of the hands together. More. Good job. Do you want more? Yeah. Talking, no. She doesn't even use a lot of like consonants really. The most I've ever heard her talk was actually when she went into the hospital last November, where she had a super high fever. It was like 104 plus, and she was just so uncomfortable. And I honestly thought she was gonna start saying something. Like she was trying to vocalize something, and I felt so bad because she was obviously in pain. But I like kind of got excited because I got to hear her voice. So, I don't know. But no, she doesn't talk. She doesn't have words. Oh, I guess we have 2 more questions. What are the priorities for Emerson now in terms of goals now that she's been seizure-free for a year? I think we're just working on the same things we've always been working on.
Therapies.
In her therapies, we're working on the fine and gross motor skills. We want her to be weight-bearing through her legs to try and build her strength and hopefully get her to maybe stand by herself. Progress has been very minimal in that area.
Speech therapy.
Yeah, speech and feeding. If we could get her to help feed herself, then that would be amazing.
Or if we can get her to chew.
I feel like the goals have been the same ever since she was a baby. And there have been certain skills that she's lost when her seizures have gotten bad, and then she'll regain them. I feel like her development is kind of all over the place. It's not linear. She's hitting these different milestones, not in the regular progression of things. Whenever a therapist asks what my goals are for her, I just say anything that helps her to be at least a little bit independent, because right now she is 100% dependent on other people doing things for her. Last question. What do you wish mothers would say or do, or I guess we could say parents, what do you wish parents would say or do after their kids say something rude about her? I think a majority of the time, kids' comments, they're not always intended to be rude. They're just making an observation, and we all know kids are super honest. I think parents' first instinct is to get really embarrassed and try and get out of the situation as quickly as possible. Kids are curious and they're honest, and so their comments a majority of the time are not a reflection on parenting skills. I think what's more important, instead of focusing so much on what the kid has said, it's focusing on your response to your child after they've made a comment. You can always tell the kids who have had more experience with kids who are different, because they're always the kids who are super kind and they ask a lot of questions, and I feel like they know how to ask the questions in a way that's not rude. But I don't know, I think everything is a learning opportunity.
Parents can bring their kids over and say hi.
Yeah.
Ask questions. I think a lot of people are embarrassed or feel that it might be rude to ask questions about Emerson's condition. We don't think that's rude at all.
We love questions. We love answering questions. I just think that a lot of people are scared of things that they don't understand or don't know. And so if you're taking the opportunity to ask questions and you're not ignoring Emerson, which is what I think a lot of people try to do because they're not sure how to, They're not sure how to approach or interact with her, and so they just avoid her, which sometimes that feels even worse because you know that they're like looking at her out the corner of their eye, and they're purposely avoiding eye contact and trying not to say anything. I think it's better to actually come over and say something and ask questions, and then just try and redirect your kids. Maybe rephrase what they said in a way that isn't rude. Like instead of saying, oh, gross or ugly or whatever, weird, you could say, oh, that's different or interesting. Unique. I think another good tip is to try and find common ground. You can find something you have in common with anybody. And so I think once you do that, then kids become more comfortable around her because they're like, oh, she is like me in some ways. Okay. I don't know how to end it.
Thank you for your questions.
Thanks for everybody who submitted questions. If you ever have any other questions, you're always welcome to ask us. Like we said, we love talking about Emerson. We kind of feel like when we talk about her, we're like bragging about her because she is really special. So we have no problems being open about her. So Hope you learned something. Happy Rare Disease Day.
Woo! Rare Disease Day, February 29th.
Or 28th when it's not a leap year, because this year's not a leap year.
Nope, last year was. You can find out more about rare disease at raredisease.org.
I don't think that's a thing.
Did you give yourself hiccups?